The next section involves the testing for bacteria and fungi. These microorganisms are very small and are often best detected by allowing them to grow outside of the body on an agar or gel that provides food for growth. The controlled growth of a microorganism is called a culture. Certain fungi called dermatophytes can grow uncontrolled on the skin of some pets, especially young dogs and cats. This fungus causes the hair to become loose and fall out, creating circular ring-like bare spots, thus earning the name ringworm. Such fungi are difficult to positively identify, and we must therefore rely on culturing to confirm a diagnosis. Special culture tubes have been developed, called DTM, or dermatophyte test medium. These contain an agar gel that readily grows the ringworm fungi. This fungus grows especially well around hair and toenails. Because this fungus is especially prevalent in the roots of affected hairs, the best results are obtained by culturing hairs plucked from the edge of the circular ring or bare area. Pluck several clumps of hair with hemostats and place them down onto the agar medium. The lid should not be screwed on too tightly as to allow air into the tiny jar. The tube should be labeled and dated, then stored in a dark area at room temperature. Beginning on day 3 or 4, the tube should be checked daily for growth and a color change from yellow to red. By day 4 or 5, the yellow agar changes to a red color, indicating the presence of the fungus specific for ringworm. After 7 to 10 days, a fuzzy white or tan growth of fungus is often observed. Both a color change and growth must be present to confirm a diagnosis of dermatophytosis or ringworm. Other fungi that happen to be present may likewise grow in the DTM tube, even causing an eventual color change, but this color change will usually not take place until after 7 or 8 days. When results are somewhat uncertain, an absolute diagnosis of ringworm can be made by a microscopic examination of the fungus. Be sure to practice appropriate hand washing around these suspect patients and specimens, as ringworm is a fungus that is contagious to humans. Culturing bacteria is quite a bit more complicated, as there are hundreds of types of bacteria and very few shortcuts to identifying them. As a result, only those hospitals with expertise in microbiology and bacteriology should undertake the culturing and identification of bacteria in-house. Commercial labs provide an excellent resource for identifying the type of bacteria present. They also provide recommendations as to the most effective antibiotics for which the bacteria seem to be susceptible. This information is called a culture and sensitivity test and is extremely helpful information to the veterinarian as he or she makes treatment decisions for patients with challenging infections. The lab takes 3 to 6 days to generate this information due to the slow growth of bacteria. Collecting a sample for a bacterial culture and sensitivity requires great skill to ensure no artificial contamination occurs. Sterile culturette swabs are available from most commercial laboratories for the collection and transport of bacterial samples. Though virtually any anatomical location on the body might be cultured, the sampling techniques remain quite similar. A vital difference exists in that some bacteria grow with oxygen. These are called aerobic bacteria, and others grow in the absence of oxygen. These are called anaerobic bacteria. One must choose the appropriate transport medium for such type of bacteria suspected. Let's begin by looking at collecting a sample with the aerobic culturette and transport tube. At a time when you are ready to take the culture, open the sterile paper sleeve by peeling it apart. Remove the plastic tube that contains the sterile culturette swab. Without touching the swab, pull the plastic tube apart. Carefully touch the sterile cotton swab to the area you wish to culture. After good contact has been made, replace the swab into the plastic tube, being careful once again not to touch anything but the inside of the tube. A generous sampling of bacteria helps to ensure accurate results are generated. A small glass capsule at the bottom of the plastic tube should be broken by squeezing it through the tube. This capsule provides moisture for the bacteria during transport. Anaerobic cultures must be transported to the lab in an agar gel that doesn't allow oxygen to get to the swab. The collecting of bacteria onto a sterile swab is quite similar to the aerobic transporter. Once the sample is on the swab, it is immersed in an oxygen-free gel. As with all laboratory samples submitted to commercial labs, be certain adequate identification and supportive information accompanies the sample. Other sterile containers may be used to transport bacterial samples being submitted for culturing. For example, urine and other fluids can be transported in a sterile red-top tube. Though we have scratched the surface of the microbiology of bacteria and fungi, the tools you have just been equipped with should allow you to provide valuable diagnostic information to the veterinarian. The next area of focus in this program is that of identifying common external parasites on the dog and cat. These external parasites, which we are about to discuss, are all quite small and can only be visualized with the help of magnification or a microscope. We will focus our attention primarily on the collection and identification of these parasites. Let's begin with mange mites. These small parasites live and burrow in the skin of dogs and cats. Because they are not surface parasites, techniques must be employed to collect samples that accurately reflect the presence or absence of these mites. The most common of these techniques is called a skin scraping. This technique involves the use of a dull scalpel blade to abrade the skin in an area suspect of mites. A scalpel blade can be easily dulled by firmly passing the cutting edge across the edge of a glass slide several times. Place a small amount of mineral oil onto the blade prior to scraping. This oil provides an adherent medium for the scraped items to adhere to. While squeezing the suspect area, pass the blade at a right angle to the skin. Squeezing the skin helps to expel mites to the surface of the skin. Scraping the surface frees the mites from the superficial skin layers in which they often live. It is often necessary to scrape until the skin just begins to get red and ooze a small amount of blood. The scrape material is then transferred to a glass slide for microscopic evaluation. Amongst the hair and other debris on the slide, mites are likely to be spotted if present. Demodectic mange appear as a cigar-shaped parasite with short, stubby legs. These parasites are especially common to dogs less than a year old. Sarcoptic mange mites are quite different in appearance and are often much more difficult to find. Multiple sites may need to be scraped before confirming sarcoptic mange as the infecting parasite. This parasite is very important to identify because sarcoptic mange mites can infect humans, giving added significance to its accurate diagnosis. Another type of mite very common to dogs and cats is the ear mite, or Otodectes. These mites create a tremendous ear itch and are quite often found in the ears of young kittens and puppies. Crawling about deep in the ear, these mites can sometimes be observed with just the magnification of the otoscope. They appear as white dots slowly moving about. A cotton-tipped applicator with a drop of mineral oil on it may also be passed into the ear canal in order to evaluate for ear mites. Once rolled onto a microscope slide, the ear mites can be readily visualized with minimal magnification. Hopefully, you have acquired some new skills and knowledge that will make you a valuable member of the diagnostic team. With the advances of technology in the laboratory, veterinarians are able to diagnose more of the diseases that pets present with. When pets get a proper diagnosis, they're likely on the way to a good recovery